Estimates of how expensive inflammatory bowel disease is difficult to give because they very much depend on the healthcare setting you're in. Um, for example, the United States have very, very high costs compared to uh, European countries, because the healthcare system is different. So this makes it quite difficult to give you real estimates. And we also have realized when we do studies trying to give overviews of this, that the data that we are relying on is also very heterogeneous. So some researchers are able to capture, say, the whole country, all patients, all expenses. Others are only able to look at one specific hospital, the costs that were um, acquired by that specific clinic. And the other important factor is that not everybody is able to capture the indirect costs, because we have the direct costs relating to treatments, examinations, contacts with healthcare providers, and then we have this huge chunk of indirect costs related to not being able to work, having to take time off work to go to the hospital, maybe having to take time off because you are having symptoms, you're unable to work, out-of-pocket expenses to buying medications, and that sort. And again, many settings, many countries, many hospitals are not able to capture that. So that makes it quite difficult. When we summarized it, we found estimates somewhere between $8,000 to $9,000 up to $12,000 to $15,000. But there's a huge per patient per year. But there's a huge range. Some patients will be much more expensive because they require multiple surgeries, expensive medications, many contacts with the hospitals, and others will have no cost because they are doing very well. They are on a stable treatment that might not be that expensive and are doing fine. So it's a difficult topic to give clear estimates of. Low income regions, probably the cost, the distribution of items causing these costs will be very different. Access to expensive treatments is more difficult, is lower in low income countries. So probably the proportion of costs caused by medications will be lower, but then probably costs caused by hospitalizations, by surgeries, would probably be higher. This is at least how it looked in high-income countries if we go back to the couple of decades before we had expensive biological treatments. At that time point, costs were mainly caused by inpatient care, surgeries, hospitalizations, and this has over the year changed. And now it's primarily outpatient care and the medications that are causing the high costs. So probably when we go to low-income countries, would have expected to be a bit more how it was a couple of decades ago in high-income countries. But then again, there are differences in social securities, how insurances are dealing with healthcare costs, how governments are dealing with these costs that are probably also different. So again, there are many things that make estimates be quite different if we compare countries with each other. For many, many years, the incidence, the number of new patients per year, has increased in many Western industrialized countries, but that seems to stabilize. And now we see that although this has stabilized, the numbers continues to increase because mortality is very low. So fortunately, this is not something, inflammatory bowel disease is not something that will cause you to live, to have a shorter life than if you would not have inflammatory bowel disease, which means that the pool of patients will increase with new patients coming into the population of patients. While, of course, patients will leave this pool because they die, but that the fewer patients are leaving sort of the sum of patients than are entering the group of patients. So we have this compounding prevalence phenomenon, so the number of patients is increasing, and this will continue at least for 1 or 2 decades more, until we probably will reach some sort of equilibrium where the total number of patients will be stable. But this looks very different depending on where you look at in the world. So in these newly industrialized countries, we still see an increase in the new number of cases per year. So there, the numbers are increasing simply because more patients are developing the disease per year and thereby increase the total patient pool.